And after that, I served as a nutrition faculty in VLCC Institute. I have qualified UGC NET and West Bengal SET as well. And currently, I'm working as a wellness coach in Goki Technology. Obviously, the thing that cannot be ignored is I am studying MNT in Cognized Nutrition as well. That has helped me a lot in learning many practical aspects.
Shoradip, change the slide, please. Next slide.
Yeah.
Yes, Arunima, carry on.
Right. So again, I would like to thank Shomendu sir for this amazing opportunity. Please be with us always and help us in each and everything. We seek your guidance always. Can I get the next slide, please? Okay, before going to the case study, I would like to share something about my fellow members. Here we have, divided ourselves as well to make different parts of the case study, where I will cover the patient's details, the patient's history part, the medications the patient is taking, and there is some reports attached as well, where we have collected that from the patients. And after that, the patient's dietary recall and anthropometric measurement part will be taken care by my friend and fellow dietitian Sonhita Roy, as she has, she's currently working as a freelance dietitian. The next part of ration chart and the other detail, including the modified diet chart, will be taken care by Chandrima Sengupta. She is also a clinical dietitian. And last but not the least, the end of the session and the two most important slides as well will be taken care by Deepanita Mishra. She is also a freelance dietitian. And the slide she will be discussing will be the lifestyle modifications. Okay, so before any further delay, let's going into the case study. Well, the patient is 32 years old, male patient named Mr. Sandeep Kumar Das. Shoradip, I'm sorry to ask you for the pointer.
Yes.
Can I get? Yeah, thank you so much. So as you can see, Mr. Sandeep Kumar Das is 32 years old. At the time of consultation, his current body weight was 63 kg. He is a teacher by occupation, holding a height of 172 centimeter. We didn't came across any kind of food allergy or food intolerance from him, but some dislikes are definitely there. That is the pumpkin, parval, gourd, and brinjal. Very common, many of us, I think, have the same. But in terms of physical activity, currently he's not on any kind of exercises and a little bit constipated as well. His current water intake lies between 2 to 2.5 liter, and the oil consumption per family per month is 3 liter for 4 members in a month. The current health issue that he was suffering, not exactly the current, because we were talking about some days back. So at that time, he was suffering from suspected UTI. E. coli was present in the urine, and there was cases of high inflammation and infectious state. But fortunately, there was no comorbidities associated with. Please move on to the next slide. Well, here the patient history is a little bit interesting, not really, but as part of being a dietitian, I find it a little bit interesting because that person has suffered from an autoimmune disease. We came to know from the recall that here I think you can find that the patient has got transverse myelitis, and that was long days back.
Exactly, transverse myelitis. You should,
Yes.
everybody, those who are not aware of the term, please go through that term, because in the recall, the patient has said about this transverse myelitis. And Arunima, thank you for incorporating this term in this slide. Thank you.
I would just like to quickly add some facts on that. It is, first of all, it is an autoimmune disease. And the second thing is it damages the myelin sheath of our neuron. Specifically, the spine of the alternate side that was damaged. In response to this, sometimes you can find very much high CRP. Even in case of this patient also, we'll see that shortly. And that transverse myelitis damaged him so well, and he got paralyzed in his lower limb portion since 2015 to 2017. Now recovered, but the gait has shortened. So unfortunate situation, but let's see how we have incorporated some good things in his life. Please go to the next slide. Well, so there you can see I have attached two very important things that have been highlighted here. One is our, can we zoom that please? Can you zoom that? Yeah. So as you can see, the CRP level here is 96.1 and our normal value lies less than 6. Basically in the clinical significance, people says it should lie between 0 to 3, but here it's just, it has already outreached, right? And again, I would like to attract your attention on the second image. Please zoom that in. I don't know why it is showing so much hazy. Okay, so here you can find the CV that the cannot see that. Actually, the EDTA in EDTA method, the RDW CV is little bit of higher. That is also for the infectious state. And if you just come down below and find the neutrophil count is quite higher, that means there must be some attack in the body. So the neutrophils have gone there to rescue the body. Well, just zoom again, go back to the normal position again. Here you can find a report attached. Can you just click on to that? So should I share that now or after that?
If it is Shorodeep, if you can share it, you can. Otherwise, we will discuss the report. On clicking the PDF, is it opening, Shorodeep? Otherwise, leave it. Okay, Shorodeep, move on to the next slide. We will share it.
It was earlier. Okay, we will share it later.
We'll share it later.
Right, right. So as you can find that CRP level was quite higher. So there is very, something very much important we need to think about the CRP. CRP is an acronym that tells us about the C-reactive protein. So it generally increases in the term of infection or any kind of inflammation in the body. There are series of incidents happens when some foreign invader attacks our body. We need some lymphocytes, we need some neutrophils. So for making that working, actually CRP is needed. So here one question comes, if anybody volunteer, is CRP a very bad protein or that is needed in our body? Is that something we always need to scary about, or without that I mean to say what the idea you people possess about CRP, where CRP is made and how CRP is helping us?
There is a question in between.
Yeah,
Rimi.
May
yes,
I?
Rimi.
Please.
Yes. So I think CRP is a very important for our body because it gives us the indication of if there is any infection or inflammation is happening in our body.
It is an inflammatory marker, right? Need anything more?
Exactly.
Anything more do you want to say about CRP?
Tina?
So may I?
Yes, Tina, you can answer.
Yes, CRP is needed for our body, but when we saw that CRP is high, then it means that is there any infection or inflammation?
That is the same thing you are saying. Anything that is Arunima is asking. I think Arunima, we can continue the discussion later because the crunch of time you have to move on.
Right.
So you just keep on discussing. At the end, we will discuss.
Definitely. Basically, CRP is nothing but an inflammatory marker that is very much common. Whenever anything, CRP means not always bad, because without CRP, you cannot even, your immune response will not be fine. Because as I have already mentioned, to make our immune cells active, cytokine is needed. And that is one of the very important, kind of CRP that is present in our body. Then comes the chemokine, that is again a part of cytokine only, but that actually, that engulfing and that type of thing is taken care by the chemokine. So without that, actually our immune system will also not respond well. So CRP is not a bad thing, but more means this is an inflammatory marker, like the inflammation has increased. That means the foreign particle or the amount of the things that has attacked our body is much in nature. It's much in number. And one thing you can just see, not only liver, but there are some other tissues. As I have mentioned, some epithelial cells are there, monocytes, lymphocytes, and macrophages will obviously be there. Even coronary smooth muscles can make it. Okay, some vascular cells are there, and kidney as well. So wherever there is inflammation, you can definitely be able to find higher CRP. Here, if you just bring that down, and you can find, I have mentioned a line that cytokines and chemokines are very important in the production and growth of lymphocytes. I have already discussed on that. Because regulation of the infection or injury, we need lymphocyte. Lymphatic nodes is a very important in part of our immune systems. So this is something we cannot really neglect. Okay, so basically cytokines are general messenger molecules, but chemokines are a special type of cytokine that already mentioned here that actually direct the migration of blood cells, I told, for engulfing the whole things or to the infected or damaged tissues. Can you get to the next slide? I don't think anybody has any doubt in that, sir.
You continue because you have crunch of time. You have
Right.
to finish it.
Right.
So we will discuss at the end.
No worries. So here, just having a look, you can find that in what cases the high CRP values we can be able to find. Well, I have mentioned some of them. Many other things are there that I have not mentioned. The very first thing what I wrote there is regulated by certain chemicals, that are some messenger chemicals, that are some inflammatory chemicals like interleukin, tumor necrosis factor, interleukin beta. So whenever there is inflammation, so that may be due to lupus, that may be due to any coronary inflammation, any kind of inflammation related to our lungs, that can be in the rheumatoid arthritis. Any kind of inflammation means you can get high CRP values, even in hyperuricemia as well, we already know. In high estrogenic state and in high leptin levels, because it can find that in obesity there are some kind of high leptin levels find. There also we have found in researches that CRP level remains high. There are many deficient people of vitamin A and K shows high CRP level. And as you know, smoking and other substances always induces oxidative stress in our body. That means there must be some cases of damage in our body, and it will induce high CRP level by increasing the inflammation. Chronic stress is a factor as well, always. High altitude and extreme cold are two other things that can really show high CRP values. Well, diet high in saturated fats and trans fats is actually connected with the high leptin levels and the obesity. So as we know, obesity is another kind of inflammation, so it will definitely show a high CRP values. And obviously, the more the sleep disturbances, the less the melatonin, the more the cortisol in our body, that is already a stress-inducing hormone and inflammatory marker. Okay, let us just quickly have a look below. Here I mentioned what is the normal CRP value. Already you have seen that, but as I told, 0 to 3 is basically the clinical one, but greater than 8 milligram per ml means something big is happening in our body. And if you remember, the value was 96. Okay, so after that, I am concluding myself, and I would like to invite Sanhita Roy for further process and progress. Thank you so much.
Thank you, Arunima, and welcome, Shangita. So in only 10-15 minutes we have discussed, we will keep another separate class for CRP, and it is very important marker or blood parameter. Because Shangita, are you ready? By that time I am just Shangita, you can switch on your video and just start. So by that time just I am continuing, because as a dietitian, when you will see patient, you need to know the blood parameters as well. Where is Shangita? So
Yes, sir. Yes, sir.
yeah, please continue.
Next slide. Sir, this is not my slide.
Oh, I'm so sorry for that, sir. I'm so sorry. Because of the internet issue, I couldn't see that. No, no worries at all. I'll just quickly discuss that and then I will leave. Please allow me again to say.
Yes, you can start. Switch on your video and please discuss.
Yeah. Well, I'm so sorry, guys, for the miscommunication that happened in between. I was there to discuss that. That was nothing but a quick medication chart. There you can find the medicines prescribed by the doctor to that particular patient while that patient was on UTI infection. The first tablet was Mahacet Plus, Cefixime. On a daily basis, the patient has to consume for 5 days post-meal. This is basically the antibiotics, ofloxacin and cefixime mixed. They target on particular type of bacteria, gram positive and gram negative, both. But as you know, E. coli is a gram negative bacteria, so this is a target oriented drug that has been given to him. Well, we all know about the paracetamol dolo that was given for 2 days, 4 times post meal. That is antipyretic, that means that will drop down the temperature, and analgesic that relieves the pain and aches that is facing by the patient. Well, Pandy and domperidone that was given again for 5 days, half an hour pre-meal. That is an anti-emetics. Well, anti-emetics, that word emetics has come from the emission, and that means just throwing out or vomiting. So this will help in releasing the nausea and vomiting symptoms. Here, I would like to highlight the patient was on nausea, vomiting since a few days because of UTI and fever as well. And the second kind of drugs, the Emeset ondansetron, that also serves the same purpose of antiemetics. Well, with that, I'm finally concluding myself. Please, Sanhita, take care of the next part.